The idea for Coral, which is the Centre of Osteopathic Research and Leadership, came from solar. So Jerry and I, my co-director at Health Sciences Research, we wanted to create a kind of hub or a physical space in our institution in London or in the UK to bring these networks and these collaborators and fellows with us.
It became really apparent during the SOLAR program that within our profession there were a few things missing. There are not many osteopaths who have research capacity or skills or training. Many have aspirations, which is fantastic, but they need support, mentoring. But there is still a gap for other potential junior researchers or people who aspire towards a research career.
So the vision for Coral is really to have a hub of expertise within osteopathy, osteopathic research, and to support others both in the UK but geographically. So whether it's PhD supervision, PhD examination, grant applications. So really to take what we've built so well within Solar and just to continue that and to grow that. So one of the challenges which faces osteopathy globally is just we don't have enough osteopaths who are also skilled in research. And that poses challenges for developing and growing the profession, both in terms of education, but also research. So Coral will seek to grow the number of research-skilled osteopaths globally through publications, through kind of mentorship programs, through education and through research projects.
Because we understand that some of us had a lot of luck and support to get where we are currently, and others, because potentially for geographical reasons, might be really isolated and it's difficult for them to access any support, training, funding or anything like that.
I'm really excited about it. It's the first time in my awareness that there's been a formalised organisation attached to a university with a bunch of people who are really keen and want to contribute in that way.
I see it's an opportunity to us to continue together, and after that we can have more publication and we can influence more osteopaths to become close to research, because there is today a bit of separation, the clinicians and the research, and we can bring them together and it will be good for the profession.
With Coral going forward, we've done all this really great work and it's going to allow us to continue and expand that. Bigger data sets, looking into more clinical trial work, interventional work that will really transform patient care and patient outcomes.
One of the things we always want from these programs is they do have a finite period of time, but the impact of not just the activities but the group themselves carries on. And so we are always encouraging our fellows when they're coming to the end of the time for that particular program to ask how are you going to keep this going? And so seeing a group like we've currently got for the SOLAR program, making plans and committing themselves to something that is going to continue on, not just to benefit them, but to help support the next generation to come through. It's incredibly exciting and really fulfilling for John and I, because we can see that this is what we want for them. This is them being leaders.
Donc oui, le fait de passer du programme SOLAR au programme Coral, ça permet donc à la fois une continuité humaine et également une consolidation de toute cette dynamique créée par le groupe. Et à l'avenir, on peut tout à fait imaginer que cette première équipe, ce premier team de leaders en recherche en ostéopathie puisse réaliser une transition avec les nouvelles générations, dans une idée de transmission intergénérationnelle entre les différents fellows, les différents groupes. Ça c'est quelque chose qui est envisagé et pour que cette dynamique perdure. Oui, tout à fait.
So I think the aim of Coral is really to be an inclusive structure where all of us will be there, but also we invite others to join us and to contact us if they want to collaborate with us.